Welcome back to the Morning Blood. For some seniors, living in their own home is a very important thing, but as time goes on, doing everyday tasks become more and more difficult.
Yeah, Ruth Busalacchi is here from Synergy Home Care to chat about their services and how to find ways to fit it into your budget, because sometimes we just plain need it. Welcome back, Ruth.
Thank you for having us
Great
back.
to see you.
Yeah, a little bit. Last time you were here, you actually brought someone with you who was using respite care, right?
Correct. It was the wife of an individual who needed support and respite, and fortunately they have a long-term care insurance policy that helps pay for our services.
Is that rare that someone would have a policy in place like that?
It's not as common. Usually you talk to your insurance agent, like your life insurance agent, to apply. Many people think that maybe Medicare Advantage covers, and Medicare Advantage is actually health insurance.
Yeah.
So it's a separate policy that you do have to take out, but 9 out of 10 people will use it, so it's a worthwhile investment.
See, I think that's fascinating. I was going to ask you, so people get it. It can be very expensive.
Sure.
It's not a cheaper form of coverage, but how many people are actually using it? When you say 9 out of 10, that's 90%.
Right.
That's definitely coverage that you're
Yeah.
probably going to end up using at some point, so it's worthwhile. And what a great service, because I remember last time you were here, there's a wonderful woman here who's a client of yours.
Yes.
Her husband is it Alzheimer's?
Yes.
Okay. And one of the things that you were helping with, because you always think of the patient and helping them, but you were helping her get respite. So she would have time, by caring for him, she would have time to go and grocery shop or go have her hair done or run errands.
And that's exactly right. If she's not getting the respite that she needs, she's going to have failing health. There are statistics that say 40% of a family caregiver themselves is going to come down with some sort of an illness because of the stress if they don't get that respite.
How do most people pay for home care?
Sure. So primarily it is out of pocket. At Synergy Home Care, I have a social service background, so the first thing I determined to do was how can I find other options?
Yeah.
So we set out to find, we have actually 5 different funding sources aside from paying out of your pocket or fitting into your budget. One is long-term care insurance.
Okay.
The other is respite grants.
Oh.
There are grants. We tap into 4 different grants.
From like where, for example?
From Milwaukee County, Department on Aging,
Okay.
Alzheimer's Association.
Okay.
And so many families qualify for that grant.
Great.
The other option that people have is often overlooked, veterans.
Yeah.
Oh, yeah.
They served our country when they were in their 20s.
Does it apply to their spouses
And
also?
surviving spouses.
Wow.
Yes.
Okay.
So we look at that, investigate if there are benefits to help pay for our services.
Yeah.
And then, you know, if people truly cannot afford our services, there's a program in our community called Family Care, which other people know as Medicaid. Medicaid will help pay for our services as well.
Wow. What about the cost of moving versus assisted living? How does that stack up?
So what we see is the average person who's going to initially need assistance in their home, somewhere around 6, maybe 9 hours a week is pretty typical.
Okay.
That's less hours than you would actually use if you were to move into an assisted living, but it's thousands of dollars cheaper because you do have to pay out of pocket for assisted living. So it's a great place to start, at least trying services in your home, because it is going to be less expensive than actually moving, and you can adjust it and see if it's enough.
That's actually a great point, because I think a lot of people only think about where are they going to go, but having that in home care can truly be something that can keep you in your place longer as well.
Correct.
What's the first step? What does somebody do when they're saying, hey, this is coming, or maybe it's already here and you need to get help now? What do they do?
We call that a change of condition. Something happened in their life, whether it was from the family saying I can no longer help, or someone had an injury or a diagnosis. We ask them to just reach out to us, and we'll sit down with them and talk to them. Get to know their situation.
I love that you get to know their situation. You also provide a funding assessment. I love that you have ideas and thoughts for people, not just on resources, but what they can do to help pay for this much needed service, especially as you think about spouses who maybe aren't ill, but they need help for their partner who does need more assistance.
And those grants, I mean, hello.
That's wonderful. Free resource and a funding assessment is something people can get by calling this number. It's free. Make sure you ask about it. Mention the Morning Blend. It's 414-763-8368. I think the key too is not waiting. You can also go to synergyhomecare.com. Same with long-term health insurance. get it before you need it.
Yeah.
So that you have it in place and it's safe and secure. Wonderful to see you.
Thanks, Ruth.
Thank you for having me.
Thank you.